Okay, I'm here with Franklin, and Franklin is at 10 days after his procedure. And you may remember Franklin as we documented his surgery day, and he's here today to have his sutures removed. And we were just talking, you know, the first night or two was a little bit rough as far as, you know, sleeping and getting used to the stitches. So he's anxious to get these stitches out. And he's anxious to have another haircut so he can look a little more normal. But overall, Franklin, how has your process been as far as recovery, wearing a hat, that kind of thing?
Everything seems to be very easy. It's not that complicated.
Okay.
So I'm very happy with everything.
And I cannot wait to see your results. Again, as you remember, Franklin, I'm going to kind of pan up here and I'll put some pictures.
Sure.
You can see that the grafts that we put in are actually growing hair, but I let him know that that's probably going to fall out. And you remember his micropigmentation that he had, as you can see here. So this is basically tattooing that sometimes people get to try to disguise the hair loss. So obviously he wasn't happy with that, and this is going to completely cover that up. So that's going to be really nice to not have to worry about that anymore. I'm going to come around to his side here and show the suture line. So again, the sutures are still in, and I'll take some pictures once these are out. But the suture is the point of this is that the suture line is not going to be an issue. And see, what you're seeing now is the sutures that are still in. But in the interest of full disclosure, we like to show all of our suture lines. So again, I want to show Franklin's suture line. And what you can see, and we just took the stitches out literally 2 minutes ago. So that little line in the center is going to be a suture line. And you can see how small that is, as if you took a pen and drew a line. I keep saying that, but this is exactly what it looks like. Sometimes it's even hard to find the suture line. Now you can see that there's still some scabs that are going to be coming off. Little tiny line in the middle. So people come from all over the country because they like the way their suture lines look. Of my past patients, you can ask any patient that's come to me. I stand by my work, I stand by my suture lines. It should never be an issue for my patients wearing their hair short. Thank you again, Franklin, but now more exciting is the results. So usually around 3 or 4 months, everything's going to start growing, and then every month it gets thicker and thicker. But thanks again, Franklin, and we'll be documenting in a couple months.
My pleasure. All right. Thank you.